many people want to join in the effort of reducing stigma and mobilizing those around them. We have about 3 people that have asked this question privately and on the wall, and perhaps you could address in a way, because I know a lot of work is already ongoing, and perhaps just to mention what is ongoing in this respect.
Lillian, thank you so much. We really welcome all of us, because this thing is not a preserve for government only. We want each one of us to bring ideas on board so that we can sit and discuss. As you look at the most important thing that has really contributed to the stigma, as we saw last time, Lillian, is the issue of how we packaged and introduced the COVID. One, I think Dr. Nyamongo said initially people saw it was the travelers who were bringing it, and that is why up to now you go home and say, have you brought COVID? The number 2, the way we managed the victims, the deaths and everything, we more of actually instilled fear, and this really brought a lot of stress. And therefore, one of the things that we have to do is to make people understand and try to remove fear from them. When Alvin talks about fear is normal, it is only normal for a short time. But when it continues, then it becomes a disease. And therefore, we must come up and actually remove the fear within the people. And what we are doing here, trying to explain what we need to do in terms of dignifying the death, managing COVID like it's a disease like any other which has come, the Ebola, the HIV and all that. I think it's part of encouraging people to say, after all, it is not as bad as we thought. And therefore, all of us, I think we may want to go back and bring up maybe the guidelines on how we are actually going to remove the stigma, and the biggest part of it is the fear. By coming up with the guidelines on how we are going to bury the dead, and actually making sure that those guidelines are not more stigmatizing, but they are actually making the burial and the death more dignified, then people will be able to reduce their fear that even if I die of COVID, I am still treated like anybody else. Because what is happening, Lillian, is that people are even fearing to come to hospital in case they get COVID, and they would be managed the way they have seen it happening. So what we are saying that we will be able to manage the deaths in terms of the burials because of the guidelines as near normal as anybody who has died from any other disease. And then the other thing is that we need to report deaths as they come, whether COVID or not, and actually be able to see them as people, not referring them as the COVID cases. That is some of the ways that we are going to actually be able to manage. And finally, the guidelines have allowed families to be able to bury their dead, to be there, and the guidelines have also allowed even at least a limited kind of service and all that. So Lillian, as we do that, we are trying to remove the fear that is so much within the communities, and they will be able to finally see COVID as any other disease, and deaths like any other death from any other ailment. So whoever wants to give input is welcome. The psychosocial team are actually getting, they want more people to join, and those who have ideas on how we can be able to manage the stigma and remove fear from people, they are most welcome. They can come to the office, and we'll be able to allocate them to the committees that are relevant in addressing some of these issues. Thank you, and over to you.